Thank God I noticed. What's going on with my iPad? Good evening, everyone. I'm AnnMarie Cronin, and I'll be hosting a special live broadcast tonight on 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician, and specialist in prevention, is here tonight to talk about how to avoid heart attack and stroke altogether and what you need to do to prevent Alzheimer's and many other chronic diseases. If you have a question, we're opening up the lines and taking your calls. So make a note of this number, 800-859-0957. We'll repeat it throughout the show, and this is your opportunity to talk directly to the doctor. Stay tuned, and we'll be right back. You're listening to 760 WJR. What happened to the music?
They said it's broken, so we're on Facebook now.
Now we're on Facebook. Okay, great.
Yeah, so everybody, we're welcome to the show. And so today we're going to be talking about an opportunity to participate. It's Listener Involvement Day. So listen to the show. We're going to offer an opportunity to participate in a research study to find a non-pharmacological option for managing blood pressure and muscle cramps. So this is something new, it's something advanced, and I'm kind of excited to be able to be involved in researching it a little bit. So we're going to be doing, I want to say a relatively small study, but we're talking about a non-pharmacological product, that's, these are usually small studies. So we'll talk more on the air about what it is, and what we're doing and how to get involved, in more of the details. Anything you guys want to go over?
Well, I mean, that's a great idea. What made you come up with that all of a sudden? That was like a brainstorm because it's, got nothing to do with pharma.
Well, someone reached out to me who makes products, makes things that are health related, who's interested in improving health, and found this product, and he basically invented it. So he's been testing it, and granted, a lot of the findings are anecdotal, but he talked to me about it, and I offered to do a study. So we're going to do this study.
Be interesting. Again, I'd like to welcome all of you to a special medical show here on 760 WJR. I'm AnnMarie Cronin, and we're here tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is with us tonight from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, as always, welcome back. You're always working on something new, and over the break on Facebook, which we always encourage listeners to tune in and see you on Facebook, you're talking about a study that you've started, a research study. Let's tell the listeners about it.
Well, thanks, AnnMarie. So we're calling today Listener Participation Night. And so someone who I know well is an inventor and has created a product. He terms it an advanced hydration. I'll call it water. Hydration is water. So it's an advanced hydration drink that, in his experience testing it and working with it and perfecting it, he's found that it seems to lower blood pressure. And so in talking to him about this, it just coincidentally, I was watching a lecture about someone who's, someone else in another part of the country who focuses on prevention like I do. that there are some electrolyte configurations, meaning sodium, potassium, calcium, things like that, that have been shown to correlate with lowered blood pressure. So all of a sudden, something that sounds like too good to be true now has some, in my opinion, real medical backing. Like there's a real scientific reason for this to work. So he offered to supply enough to do a study, and I thought we should engage the listeners to participate. So, we'll talk about this the whole show. And if you have high blood pressure, whether you're on medicines or not, if your blood pressure's on the high end and you want to try to avoid being on a medicine, then I would consider you to be a possible candidate to participate in the study. So the way to at least go to the next step is to go to colendermd.com, which is our website. So Kolender, my last name, md.com. And there should be a tag that you can join. And of course, it's not about joining, but just put your name in and contact information. And then over the next week or two, someone will reach out to you to get more information. We'll be sending out more forms to fill out and consent to treat, things like that. But we'll be figuring out who to include in the study. So I can't promise all the people who sign up for this will be included. We're going to select maybe 20 people who, will fit the criteria that we still have to develop. But I think that's enough to kind of start this and give it a short course of therapy and see what happens.
That's actually amazing, because when you stop and think about it, the number of Americans that are on blood pressure medication, it's just one day you go to your PCP, get your blood pressure taken, it's high, and the immediate is jumped to pharmacological, you're taking pills for basically the rest of your life. And I'm just curious, I mean, when you talked about this over the break and on Facebook, I was wondering, why didn't people think about this before? If there was any other alternative to controlling blood pressure and bringing it down and bringing it under control without having to use medication. Because basically, and I'm asking a question here, is medication then for the rest of your life if you have high blood pressure?
Well, most people end up on medicine. It is difficult to stop it because, again, the mindset here, as established by the FDA, as backed by our insurance companies, is a pill for every problem. So we've all been brainwashed into thinking that if you have a problem, you need a pill to handle it. And we all have at least one pill for each medical problem that we have, which of course is not great thinking, because all of our conditions that contribute to chronic disease all interact with each other. So, of course, we've talked about sleep a lot on the show, and now in the practice, what I do is make sure that this person doesn't have sleep apnea. And I found that treating sleep apnea actually gets people off pills. So
Off what kind of pills?
blood pressure pills and heart
Okay,
pills.
heart
So
pills and other, not just blood pressure.
the
Interesting.
lack of attention to reasons for people to have high blood pressure and heart problems, and not addressing sleep issues is bordered on negligence. We've said this before, that if you have a heart condition, if you have difficult to treat high blood pressure or an irregular heartbeat, and any one of your doctors has not demanded that you get a sleep study, you're really being misled. And so it's very important to look for these underlying causes. And now we have another underlying cause to recognize and possibly manage with a drink. And, so we'll talk more about, why this should do something. I'm not going to get into the proprietary issues and things like that, but why not handle this a different way?
Yeah, well, that's very interesting information, but let's take a short break and we'll come back and talk about this some more. Again, you're listening to our weekly live medical radio show where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We're here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you would like to talk to the doctor directly about what you need to do to prevent or reverse disease, call us at 800-859-0957. You're listening to 760 WJR. So that's pretty remarkable.
Yeah, no, this should be fun. I'm excited to be able to look at it and see what's going on. And, we do have a Facebook call, which I can address. It's on the
Okay.
messages.
You didn't
So
show
we'll-
up, Katharina?
Yeah,
Okay.
it is. It's been so we'll. Oh, I can't.
Okay.
Okay, we've been. Thank you for the heads up. That's too bad.
Okay. Why are you getting them and she's not?
Okay. Okay, you got it.
So are we waiting until we come back?
Yeah.
Okay.
I mean, so anyway. No, I think this is fun, and then we'll talk about cramps the next time. Like the next
like cramps.
treatment opportunity. Yeah, but we'll talk more about the thing and keep giving the website out and stuff like that. So people listen on Facebook and you want to be in, you're in the Metro Detroit area and you want to consider yourself for this study, then go ahead and go on.
I know, but you're only looking for how
calendarmd.com.
many people to be part of the study.
Well, it doesn't matter if we are only looking for 20. We might need 200 people to wean through to find the right candidates. So this
What
isn't.
are the right candidates? What do you need to be part of the study?
I mean, honestly, we haven't gone through what that is yet, but they obviously have to be able to, take the fluid. They have to be able to prove that they're taking the fluid. They have to be able to at least be tech savvy enough to show that they're, because we're going to have to watch them doing it. It's like getting a COVID swab on telemedicine. The doctor literally watches you do the test on the telehealth. So we're going to have to do something like that where we're observing the person taking the treatment.
We've got someone.
Okay.
And so, there's going to be other criteria that we have to make sure people can get through so that we can, first, that they have the condition that we want to treat. And, they're not out of our range. I don't want to have someone whose blood pressure is 200. That's, I don't want that liability.
Sure. Well, when we come back, do you want to take the call first before
Sure,
you go
yeah,
back
take
into
the call.
this? All right. Who is it?
It's John from Tawas. Is it called Tawas?
Tawas.
Okay.
There are two.
Yeah, okay. Talking.
Welcome back to our special live weekly medical show on 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician in Birmingham, Michigan. As a recognized leader in the field of catastrophic disease prevention, including heart attack, stroke, diabetes, and many chronic conditions, he's with us tonight to give some hard advice on what we need to do to avoid heart attack and stroke altogether. Through advanced and more sophisticated diagnostic technology, we're now able to arrest and reverse the process of these silent killers. We're inviting listeners to call in with your questions at 800-859-0957. Dr. Kolender, you're talking about research you're working on right now, but we've got some callers, so let's go. Katharina, who do you have?
Yes, we've got John from Tawas. Thank you for joining us, John. John, what is your question?
Hi, Dr. Kolender. We see there's a lot of increase in IBS and Crohn's disease, and I've done a little bit of research. What is his thoughts on restoring the microbiome in the gut? And does that work, or what is...
Well, thanks for
wondering
calling,
about
John. Yeah, no, I think that's a great question. So the gut is a source of inflammation that generates autoimmunity. So it's important to recognize that this is a source of illness. So I do try to recognize that in some patients that have symptoms. From my perspective, this is really new science, and we as doctors do not know, how to manipulate somebody's microbiome. I mean, there's a lot of research going on. It might be 15 to 20 years before that's being done. But in my practice, I found that if we put people on anti-inflammatory diets, a lot of people get better. For the people that don't fully recover on a anti-inflammatory diet, there are some supplements that I might use. And so I'll, put a cocktail of supplements together and then see how that goes. If they need additional help, we might add on some peptides. That's another topic we're not going to get into, but, so there's layers to the treatment. And ideally, once we've used some of these supplements or peptides, the food can continue to be the treatment, which is just eating the right foods for you. And I've had some success with that. It's just hard for some people to stay on what needs to be a pretty restrictive diet. So the microbiome is a critical part of our health. There's just, I use food as a treatment there, and it's about educating the patients and being able to recognize who's having an issue there.
Okay, John, thank you for calling. Catherine, you have another caller?
Yes, we do. We've got Siobhan from England. Siobhan, what's your question?
Our co-host, Siobhan, welcome. Thanks for plugging in.
Yes. Hi, Dr. Kolender. I know I'm very sad to not be a part of the show tonight, but I wanted to call in. I'm in England right now where it's almost 1 a.m. So I wanted to call in with a question as a listener today.
Well, let's before you ask the
you're talking
question,
about-
Siobhan, let's just let people know the reason you're in England. You're traveling, touring with Starsight, the band. Congratulations. Go ahead with your question.
Thank you. So it's great that you're talking about blood pressure. And I was just curious, Dr. Kolender, if you can talk, if there is any connection between inflammation and high blood pressure. Is there a correlation there?
I would say high blood pressure. Thanks for calling, staying up so late to listen. So you get your sleep. And so high blood pressure is a source of inflammation. And, another area that we look at, which is a source of inflammation that can impact blood pressure, is elevated uric acid levels. I think we talked about that the last couple of weeks as a relatively under-recognized driver of poor vascular health. So we now treat people with elevated uric acids, whether or not they have gout, because traditionally uric acid is associated with gout. And there are studies that show that elevated uric acids with treatment positively impacts cardiovascular events. And there is a connection between uric acid and high blood pressure as well. So, we were just talking off the air too about how all these areas are interconnected. It's really hard to isolate one problem and say, okay, this helps, because all of it together impacts, and you have to hit all these areas in different people at the same time and recognize their individual issues. Like, do they have, gut dysbiosis, which is a dysfunctioning gut microbiome? Do they have other autoimmune issues that we need to address, all generating inflammation that can have, negative health implications for themselves?
All right, Siobhan. Well, good luck on that. Did you finish the question, Dr. Kolender?
Yeah, I'm done.
If I'd known she was going to call in, I would have had her co-host the show with us.
Right.
So you're still awake over there in England at 1 o'clock in the morning, but good luck on the tour. And we'll have you co-host when you come back.
Great show.
Yeah,
thanks.
thank you. All right. So we have any other callers, Katrina?
No,
we're good.
Yeah.
Okay, so, getting back to our study, if you are a listener, obviously you're listening to the show and you want to participate, go to colendermd.com and you can just put your name in the contact sheet with some information so we can get back to you in a week or two as we start to put the study together. So, it's really about getting your body's electrolytes right. And like I was saying, coincidentally, I was learning on my own about opportunities for reducing cardiovascular risk that I didn't know. And electrolyte balancing is one of them. So I don't want listeners to hear, first, I'm not going to get in the details because it's, I want to say it's a proprietary product, but I shouldn't say too proprietary. The ingredients are on the label of exactly what's in there, and it's really just electrolytes. But I do not want you all to go and say, well, I'm going to go get a powder of electrolytes that you can buy and put it in your water bottle and you'll be okay. Because it's not just about the electrolytes, it's exactly which electrolytes they are. And it's about the kind of water and the way that it's put together about delivering what you need to go to the right place. And I think there's something specific about this product that allows that to happen. Now, keep in mind, I sound like I'm shilling for this, and I am not. I'm not paid, for this. I'm not selling it. I'm not telling anyone what it is. I'm not naming the product. I just thought this was a cool thing to do and to do a little study and help my friend out to do that. So to publish a study based on the findings of using his product.
Well, it's not just about your friend, and everybody knows that you're an ethical person and that you're, that you don't push product. We never push any products on this show, but I just want to say that this is an amazing concept, thinking about the number of people who have been chained to medication for the rest of their lives who have high blood pressure. And here is an alternative that you're looking at. And I'm just amazed that there haven't been other studies that have been doing this and looking at other alternatives other than pharma for the rest of your life.
Well, there's the thing about this is that this is a way to produce hydration that really not many people in the world can do, because he's an inventor and created a way to process. I'm going to use the word process, but that's not the right word, but it is a way to, he does something to water that is pure. Let me assure you that it's pure water that probably allows these electrolytes to get where they need to go. It keeps the intracellular electrolytes intracellular, the extracellular ones extracellular, and that may do something to allow everything to work better. And when your electrolytes in the right spot, obviously your nerves are better, your cells work better, your mitochondria is better, everything is. So I'm very interested in seeing if this plays out the way he's been experiencing it and from people he's given it to. So, and if it is, that's a major deal. It's a major deal.
It's a very major deal. Let's come back and talk more about this on the other side of the break. Again, you're listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or you have a question on any of the subjects we're discussing tonight, give us a call at 800-859-0957. You're listening to 760 WJR. And we are back on Facebook. I think we might want to, I was thinking about this. Does everybody who's listening know what electrolytes are?
Sure. We can get
They
into
do.
that a little bit. I
I
mean, they
mean-
should, but we can talk about that.
Mm-hmm. Because it's like, what is it that actually causes high blood pressure, and how come so many people have it, and why is
There aren't great answers to those questions because it's so common that we don't really know why any one person has high blood pressure. It just is. And I wish I could tell you a better answer other than as people get older, there may be some loss of elasticity of the arteries, but that's just not a good answer that I'd want to talk about. There's no good answers of why people have high blood pressure. There's
is it more prevalent here in this country?
I think it's, we were talking about increasing global cardiovascular risk. I think it's everywhere,
Mm-hmm.
But it's not like diabetes.
Mm-hmm.
But it's, it's a problem here. And people are, we need to be much lower than we are.
Mm-hmm.
Granted, people don't want to be on meds. So it's probably as much medicines are prescribed for blood pressure, we're probably still all undertreated.
Mm-hmm.
And again, but that's also because we're not educating people on lifestyle. We're not educating people on identifying other causes like sleep apnea. And yeah, so this would be pretty neat if you can, have a drink every day that impacts your blood pressure.
That's actually pretty remarkable. I
Well,
mean, stuff.
that'll show, it'll prove, but there is, we'll talk on the air about the cramping and all that, but there's data that, again, I didn't know this until it just happened. I read this, I got this lecture that I listened to, and then had my meeting with him the next day, and I walked in, I'm like, let me see the can, and it's like, of course, these are the things that studies show.
We've got two.
All right, go to the callers. Good.
Okay. Yeah, I mean that's it's pretty amazing, but you want to continue to explain this to people, and then you're you're going to still keep pushing and calling you and signing up for it.
Yeah,
I mean, I think you'll get a lot of people signing up for
good.
it. Well, how many are you willing to take on?
Well, I think he only wants to supply material for about 20 people.
Mhm,
So I mean, first we got to see who we get. I mean, I can always call from the practice too. It's not like I can't pull 20 people out of my practice.
Sure.
Yeah.
And how
So
long does the study last? How long do you think it's going to take?
we're not going to do that long. I mean, it's as long as he's going to let me do it. But he
Oh.
thinks the results come in fast.
Mm-hmm.
Again, it might only be 2 weeks. It might be a week.
Mm-hmm. Going to be interesting. Very interesting. It's only going to turn the idea of being medicated the rest of your life upside down if they find some solutions to it.
It'll be cool. So I'm going to offer them, the people that participate from the radio show, a free CIMT as
That's a great idea.
as a prize for doing it. So
Oh.
at the end we'll time it to the end of the study that we do a CIMT at the end.
Yeah. So we've got a couple of calls.
Okay,
We'll
let's
just
do
go
that.
straight to them. You have two?
Yes.
All right. So we're almost ready to go back on the air, right? Welcome back to our special live medical broadcast on 760 WJR. We're fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here tonight to give us some street talk about two important topics, prevention and being proactive. Please tune into our weekly shows Sunday afternoon at 3 and live Thursday at 7. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. That being said, Katharina, you've got a couple of calls. Who's calling?
Yes, we've got David from Windsor. Thanks for joining us, David. What's your question?
Yes, my question for Dr. Kolender is this. Dr. Kolender, we hear oftentimes about people going to the doctor, and the doctor just gives, going for problems, and the doctor just treats them with pills without even discovering the cause of the major difficulty. Again, would you suppose that would be the healthcare system itself or both? What would you suggest about all that?
David, it's both. I interviewed a prospective patient this week who was seeing another doctor who I would have said has a decent reputation in the community. And this person told me that all he gets out of this guy who he thought well of, that all the doctor did is refer. And he called his doctor a clearinghouse, where he goes in, he says his problem, he gets a referral, or he might get a prescription. And this is someone who's got a great reputation. That's just not practicing medicine. That is just being a clearinghouse. And I'm pretty sure you don't need to be a doctor to know to send some of the stomach problem to a GI doctor and a skin problem to be a dermatologist. You don't need to spend money to get that. What's the purpose of your job and your training if that's all you're going to do? And so the government and the insurance systems have really reduced primary care to data collection people. We're just minions to click boxes. And so that's who you're all going to. You're all just widgets going to the widget factory where the doctor just siphons you off on a different conveyor belt to go to another place. And then guess what? No one even looks at the reports or the follow-up from where you went. It just come back and it's like nothing happened. So, those are choices you all have as listeners to either stay that course and go to the widget, get on the widget machine, or go find someone who's going to be available for you, who has the time to practice better medicine and explore areas that aren't traditionally available. So it is sad. And again, this is someone, if someone would ask me for a referral, I'd probably give him this name because
Right.
he's in the area where I practice, and he's always had a good reputation, but not if his patient thinks of him as a as a referral source.
Hmm.
I mean, you don't, that's just not practicing medicine.
Not at all. You're right. He's become a clearinghouse.
Yeah. Do you have another
Sad
call?
for the patients.
Yes, we do. We've got Elaine from Macomb. Elaine, thanks for calling in. What's your question?
Hey, I hate to be a problem child for him. I've listened to the program. I kind of amaze myself because after having taken care of both my parents and my in-laws, I really don't have much of a good opinion of doctoring. And I'm 82. I don't take any medications. I don't go to doctors. But a couple things he said tonight kind of clang with me because I know I got a uric acid problem because I'm a postmenopausal woman and I have gout and I treat it with cherries and it goes away in a few minutes and so on. But I've also been nagged from time to time when I've gone into like these free health clinics for something. They get on me about my blood pressure and it's maybe 160 over 87 or something. And they're running, and I will not take drugs of any sort, period.
All right,
No.
Dr.
Well,
Kolender,
you
what-
are a
what-
problem child, aren't you?
Right.
So, well, Elaine, thanks for calling. And you have every right to be suspicious of doctors because, so am I. This is what we're talking about, which is the system is broken. So when you go to a member of the system, someone who's operating within the system, then of course you're going to be suspicious because it feels like you're being mishandled because you are. And I think if you had better information about your health and your risk of events, that you might feel differently. Now, I'm not here to convince you because you don't have the data that represents you and where you are on a spectrum of vascular disease. And if you did, you might feel differently. And that's really what I base everything I do on, is that we don't get the right data. And if you're given the right data, you're going to behave differently, you're going to make better choices because the data's real. It can be followed. It makes sense. It is logical. We're not measuring surrogate markers. We're not checking the LDL cholesterol to know if you're going to have a heart attack. We're going to actually look at your plaque and see if you're going to have a heart attack. So that's why you're suspicious, and it's not a problem. It's just you just don't know, and you don't know where you stand. You don't know your profile. That's you. Just so I think if you did, you might think differently. I'm not saying you've got to take pills, but you might do things differently, and then you can recheck your profile and see if it improves. And if it doesn't, you might go, well, maybe it's time to do something more. And this is a process. And that's why you're suspicious, and you deserve to be suspicious.
I know, but I will say that I do feel that she ought to have her profile. Know what's wrong with you. Have yourself completely checked out.
Right.
You
And
don't need to act on it. You don't need to go on medication. You
Well-
don't need to follow the doctor's advice. But I do think you need to know if you have plaque.
You got to know your data. You got to know where you stand. So, standing on ceremony, Elaine, and saying, well, I'm not doing this, I'm not doing that, without really knowing what's going on, is potentially dangerous. And even though you've made it to 82 and you sound great, it's never too late to start getting healthier. But God forbid something bad happens with untreated high blood pressure, and you have some event that makes you disabled, and now you're a dependent on other people to take care of you. You wouldn't like that, and neither would the people who are obligated to take care of you. So you owe it to yourself and the people who you love you to make sure you're going to stay healthy the rest of your life, so that they're not stuck. These words stuck, taking care of you when the problem that may or may not happen is preventable.
Yeah, and the whole idea is that you really need to know your profile, and you need to get the necessary testing. You need blood tests, you need screening, of all the tests that you're talking about all the time on the show. I mean, that's valuable information, because then you know where you stand. You can choose to not act on it.
Yep, absolutely. Before the next segment, I just want to again talk about the study for a minute, and we'll talk more about it the next segment if we can. But listeners should know that I am going to provide a CIMT test, a carotid intimate media thickness test, to the study participants from the show. Applying to be in the study and not being accepted doesn't mean we're going to get a CIMT. Only the people who are accepted to participate in the study will. And of course, I'll interpret it and go over the results with all the participants. So that's some incentive for people to call in or go on kolendermd.com to see if they're a candidate. And again, before we go to the next segment and go to commercial, muscle cramping is another area that we're looking at. So I know muscle cramping is very common. So if you have muscle cramping, you are also a candidate for the study.
Well, that's good to know. So let's hope I'm sure you'll get a lot of callers and a lot of people that'll want to sign up. Anyway, in the meantime, we have to take a quick break. You are listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subjects we're discussing and you would like to talk directly to the doctor, call 800-859-0957. Again, it's 800-859-0957. You're listening to 760 WJR. So we are back on Facebook, and we are going into last
5,
segment.
right.
Do you have one more caller? Who is it?
Scott from Dearborn.
Okay.
So I do want to rehash the study one more time.
Yeah.
The
So
website.
do you want to take this call?
Yeah.
Okay, so we'll start with that, and then
Yeah.
you'll go on.
Calls are good.
That you should
I don't need that much more time, a minute or two.
To cut it shorter.
Right.
Your answers are long.
We're getting in everything we need to do.
I know, that's right. Okay,
It's-
that's good. Anyway, so this is really radical. I mean, I think that what if this turns out to be a go that you can solve things with some kind of electrolyte water?
It'd be great.
Wow.
And we just have to review that people cannot just take any random electrolyte drink and think they're doing the job.
Right. Well, I'm sure it'll all have to be measured out. I mean, you'll have to come up with a very specific protocol for how that it becomes a treatment protocol then.
I think it's really going to be just have 2 or 3 drinks a day. That's it.
So people can just do it themselves?
Yeah.
They don't need to come back and be tested or checked out or...
Well, we're going to get pre-treatment measurements.
Mm-hmm.
And get their medical history and some things, and then supply the product, and then test them at some to be established time, and when we come back in for the review and to their exit data collection, we'll do the CIMT.
Mm-hmm.
So let's go through that on the air.
Okay.
We have 2 callers.
You have 2 now. Okay. Well,
So let's do one call. Yeah,
who's the other caller?
Ellen from Bloomfield.
Scott's a regular caller now, but
So should we take Ellen from Bloomfield first?
no, you got to take them in order.
Says who?
Siobhan.
Siobhan's on tour right now.
I
I'm
know,
the
but
host of the show.
she's right about that.
Why? I mean, we do want to get some other people with other opinions on.
Well,
I think
let's take the call.
let's just take
I'll
the
answer
calls.
fast. I'll
Okay.
answer quicker.
So who are we taking first?
And
then?
if the call takes too long, you got to cut them off.
I will.
You did, and you did. do Scott in order.
We'll do Scott in order. You want
Yeah.
him first? Okay, then I'm going to cut him short because we've got to wrap this up. No, I mean,
Yeah.
you want to finish your
Right.
story here.
Right. Absolutely.
That's the whole point of the whole show.
Yep.
All right. So this is interesting, very interesting to see where this is going to go. When are you starting out taking applications? Immediately?
Well, people are hopefully going online, putting their name in
Right
now.
now,
But I
right.
mean, it's not like tomorrow we're gonna, we have
No.
time. There's no time frame for this. Just to hash it out and start doing the study protocol and getting things ready and getting some names and then we'll wean it down to some numbers and have people come in and wean
Right.
it down further. And
Yeah, it's pretty dramatic if it can be, if you can get rid of dependency on drugs for the rest of your life. That's pretty
well,
dramatic.
even if it's 50% effective, that's major.
Exactly, of course. Welcome back to the final segment of our special weekly live broadcast here on 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician, and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call at 800-859-0957. Again, that's 800-859-0957. And I know, Dr. Kolender, we want to wrap up talking about the study you're embarking on, but Katharina's got a couple of calls. Who's on the line?
Yes, we've got Scott from Dearborn. Thanks for joining us, Scott. What's your question?
Yeah, hi, doctors. Thank you very much. I know I call quite a bit, and but your last two callers really upset me because knowing what my wife went through, and it's like we're all just numbers here. When you deal with the insurance company and some of the doctors, and they put you in a category, but
Well, Scott, what's your question? Let's get to your question. What is your question for the doctor? Because we are backed up with calls here. What's your question?
Okay, I just want to know, like we're all treated like cows in a factory, like
Well, thank Scott. We appreciate you calling. That's why I refer to everyone as widgets. A
Right.
widget is a manufacturing term, that logistics people use to figure out how to get more people through the turnstile. And that's how healthcare is being measured now, not by success, but by the volume. And we're in a volume medicine environment, which is not conducive to your health. So it's sad. And this is what we've been preaching here for a long time. You got to get out of that system. It's a choice each and every one of you have to make to do it.
Yeah, I guess the message here is it's unfortunate, but we have to seek out doctors that are going to do their job and that are going to be invested in prevention
Right.
and that are going to give us the necessary screening. As I said before, it's incumbent on the patient, the
It's
listener.
out there. You got to
It's
go
out
do
there.
it. Stop complaining about it.
Okay, sorry, we're backed up. We're going to
Okay.
have to take our next call. Katharina?
Yeah, we've got Ellen from Bloomfield. Thanks for joining us, Ellen. What's your question?
Hi there. I was listening just a few minutes ago, and I heard about muscle cramps. I get a lot of Charlie horses, and for a long time I thought, oh, I'm just not drinking enough water. Well, I've increased my water uptake, and I'm just wondering why it still happens. I get them a lot at night. It's not so much in my calves, but like the back of my thigh area. And sometimes I almost feel like it's like in my my trunk area, like in my midsection.
Oh, geez, that's
that
a
I
lot.
have almost like,
Well, Ellen,
Yeah.
you sound like a great candidate for the study.
Yeah,
So
sign
go
up.
to colendermd.com. I realize I'm not answering your question, but go to colendermd.com. If the listeners listening have high blood pressure, treated or not, who have cramping, go ahead, please, and sign up, and we will see if we can include you in the study and find a remedy for you. Again, we have to prove it that it works, but we have a lot of anecdotal reports that it's positive, but we need to do a research study that shows that it is. And I also want to reinforce the listening audience, this is not about taking your, water bottle and adding some over-the-counter electrolyte powder to it and drinking it. We're testing an advanced hydration technology that will put the electrolytes exactly where they need to go. It's about getting them to where they need to be.
All right, look, we got to get moving on here. Thank you for calling. Go ahead.
Yes, we
Katharina.
got Nancy from Yslante. Nancy, what's your question?
Hi, Dr. Kolender. I'm similar, and my husband's similar with our blood pressure, and we wanted to be part of the study.
Well, thanks for
How do we get
calling.
Congratulations.
Well, so go to colendermd.com and you each set up a separate enrollee sign-in page, and we will reach out to you soon. So this isn't going to be like tomorrow, come in and get started. This is going to take a few weeks to develop and get all of our protocols going, but we'll have you. And again, I want to remind listeners that for the people that we choose to be in the study, we will be performing as a thank you,
CIMT.
a CIMT on you, and I'll be able to go over results and also just make sure that we are up and up. That is not being provided by the manufacturer. The manufacturer is providing the product, and we're doing the CIMT as a thank you for your participation.
Okay, go ahead. Katharina,
Yes.
another call.
Yep. We got Dennis from Livonia. Hi, Dennis. Thanks for joining. What's your question?
Hi, doctor. My question is, I'm starting to have issue with my blood pressure where it just started this year to where I'm starting to get to the point where I'll feel my heart racing and and it takes a while for the recovery. And when I take the blood pressure, depending on machines and everything else, it's different. Like it could be as high as 170 over 112, and then it go back down, and then it'd be 150 over 90 something, and then I go in the doctor's office, and it was like they got it down to like 139 over 87 or something like that. So my doctor wasn't that concerned about it, but I'm just to the point where I don't sleep good, and I have just tired. I
Well,
get tired easy, but
so ask your doctor for a 24-hour ambulatory measurement, because there's something called white coat hypertension where people are normal, but when they go in the doctor's office, they have elevated blood pressure. Then there's masked hypertension where people are elevated at home. It's a lot less common, and then they're normal in the doctor's office. So you need more information. Number one is bring your machine in with you to be calibrated by the doctor. When I mean calibrated, that means make sure it's working. And then there's some specific, there's a process to getting your blood pressure at home, and look it up. We don't have time to go over it because we got a minute to go, but wait a couple minutes, sit with your feet on the floor, have the machine a certain way. So that's all online where you can say, how do I get my blood pressure at home, so that you're doing it in a consistent manner. And you've got to make sure that you don't have, just because it's okay, you've got to make sure your machine is accurate. So you do have a little bit of a mystery, but it's not something that can't be figured out. If you have high blood pressure, you got to do something about it. And again, you're invited to sign in to colendermd.com, and when we will see if you're a candidate for the study.
Absolutely. And also, I think his doctor should be walking him through this procedure.
Right. And then if you get chosen for the study, you get a CIMT for your effort.
Absolutely.
So please go ahead and check that out. But yeah, you've got to do all those things, calibrate your machine and make sure it's working.
Well, Dr. Kolender, unfortunately, we've only got 45 seconds left. What's your final message for the listeners?
Well, the final message is, for today's show is, if you have elevated blood pressure, treat it or not, or you have muscle cramping that wakes you up from sleep, and you'd like to participate in our study to identify an advanced hydration technology that could possibly test the theory about whether it works or not, please sign up, colendermd.com, and we will see if you're a candidate for the study.
Great. And this would actually take people off medication, which is the end result we're hoping for.
Well, we
if it
want to have their
works.
blood pressure controlled. That's
Right,
the end
under
result.
control. Absolutely. Well, unfortunately, we're out of time, so I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you got some useful information on how to be your own advocate and take charge of your health, whatever your medical journey. Please continue to tune into our shows Sunday afternoon at 3, Thursday evening at 7 p.m. for the latest medical updates. And thanks for listening to 760 WJR. Good night and be well.